Hey everyone, welcome back to our channel, DocDecoded, where we break down health topics into simple, easy to understand bites. Today, we're talking about that annoying, sometimes soul crushing companion we all know too well, headache. Ever had one so bad it made you questions, including that third cup of coffee or skipping lunch? Yeah, we've all been there. So, why do we get headaches? When should you actually worry? And can you really blame your boss for triggering a migraine? Understand, whenever you get any kind of pain, it's the body's way of saying, hey, something's off. Let's break it all down. First off, let's understand what a headache actually is. A headache is pain in any region of the head. But why do we feel pain? Pain usually occurs when receptors are stimulated in response to injury, swelling, tension or distension, and even changes in blood vessels. Thus, pain is a normal physiologic response mediated by a healthy nervous system. Pain can also occur when pain-producing pathways of peripheral or central nervous system are damaged or activated inappropriately. Headache may occur from either or both mechanism. Headache can range from sharp to dull, can appear gradually or suddenly, and can last from less than an hour to several days. There are many types of headaches, but they mainly fall into two categories, primary and secondary headaches. Primary headaches are not caused by any underlying condition, however often results in considerable disability and decrease in patients' quality of life. The most common primary ones include tension headaches. These are the most common. Think of a tight band around your head, often caused by stress or poor posture. Migraine, this one's more intense. It may come with throbbing pain, nausea, and sensitivity to light and sound. Some people even get some warning signs called as aura. Migraine, which is very common. We are dealing dedicatedly. Please find the link in the description. You may get more information regarding your or your loved one's suffering. Cluster headaches. These are less common, but extremely painful. They occur in groups or clusters, often around one eye, thus most often one-sided. Exertional headache. This aggravates on strenuous works or physical activity, even things like coughing or intense exercise. Now, secondary headaches are caused by another issue like an infection, high blood pressure, sinus problems, or even a brain tumor, stroke or hemorrhage that is bleeding inside brain or its coverings. Scary? A bit, but thankfully secondary headache is much less common than primary headache. However, you should be cautious of these through regular health checkup. So what brings on a headache? Here are some common triggers. What's setting off your headache? Dehydration, hunger or skipping meals, lack of sleep, stress, screen time and eye strain, strong smells or loud noise, hormonal changes. Especially in women for migraines, specific foods like chocolate, cheese, caffeine, or alcohol can also be triggers. Refractive errors or difficult vision may strain the muscles around eyes and temple, causing headache. Underlying recurrent headache disorders may be activated by pain that follows ear or dental procedures. Thus, headache as a result of diseased tissue or trauma may reawaken in otherwise silent migraine syndrome. Most headaches are annoying but not alarming. But here are some red flags where you should see a doctor immediately. Sudden severe headache, often described as the worst ever. First, severe headache. Headache with fever, stiff neck, confusion or blurry vision. Vomiting that precedes headache onset after age of 55. New headache after a head injury. Headache that wakes you from sleep. Fever with unexplained systematic signs. Pain with local tenderness. Headaches that get worse over time. These could indicate something more serious like meningitis, bleeding, or a tumor. In such cases, don't ignore them. Have you or someone you know ever had a headache that turned out to be something more? Share your story. Your experience might help others. Okay, so how can you treat and prevent common headaches? For tension headache or mild migraines, rest in a quiet, dark room. Use a cold or warm compress. Stay hydrated. Over-the-counter medications like paracetamol or ibuprofen can be taken only if headache is only occasional. For chronic or frequent headaches, it's best to keep a headache diary. Track your meals and sleep. Observe your stress, workload more to spot patterns. There may be a pattern hiding in plain sight. If worsening of symptoms or persistent long-duration headache, which may or may not be associated with vomiting, you should approach a nearby physician to rule out the causes. How can you avoid to suffer from headache? Stick to a regular sleep schedule. Eat balanced meals. Stay hydrated. Managing stress with yoga or meditation. Reducing screen time, staying physically active. Exercise helps more than you think. Mini challenge for you. Try cutting screen time by just 30 minutes today and see if it makes a difference. Let me know how it goes. Headache can be a real pain, literally, but understanding them is the first step to manage. If you're dealing with frequent or severe headaches, don't hesitate to reach out to a healthcare professional. So what happens when you visit the doc? They'll take your history and check for serious causes, especially if it's a sudden or new severe headache. The patient who present with a sudden new severe headache has differential diagnoses that are quite different from the recurring headache over many years. Patients with recent onset of pain require prompt evaluation and appropriate treatment because of probability of meningitis, subarachnoid hemorrhage, epidural or subdural hematoma, glaucoma, tumor, and purulent sinusitis. These require rapid diagnosis and adequate management. Doctor may suggest you for a CT scan or MRI screening purposes. In certain cases, lumbar puncture may be required. A general evaluation of acute headache might include cranial arteries palpation, cervical spine examination, passive movement of head, investigation on cardiovascular and renal status by blood pressure monitoring, neck movement test, and urine examination. Doctor may also ask you for an eye examination, whether refractive error or fundoscopy, intraocular pressure measurement, etc. Doctors also look for the signs of anxiety or depression because mental health and headache are often connected. Treatment of headache is largely ineffective until the primary cause of problem is addressed. Most patients with headache will be seen first in a primary care setting. Remember, self-medicating long-term can delay diagnosis. If it's frequent, don't pop pills every time. See your doctor. In absence of warning signs, a reasonable approach is to treat symptomatically, followed by diagnosis through investigations. After the treatment is initiated, follow-up care is essential to monitor its progress or to identify any worrisome cause. A quick recap. Headache can be frustrating, but knowing what kind you have, what triggers it, when to worry makes all the difference. The most important takeaway: don't ignore new or changing headaches, and don't suffer in silence. Help is out there. If you found this video helpful, give it a thumbs up and subscribe, and hit that bell so you don't miss our next Health Decode. Got questions or want to share your headache horror stories? Drop them in the comments. I'd love to hear from you. Stay hydrated, stay healthy, and I'll see you in the next one.